Good afternoon, everyone. This is Dr. Samya Singh, and I'm here to present my novel grading system after successful macular hole surgery, which is based on ELM and EZ restoration. Macular hole is treated surgically by 3-port pars plana vitrectomy combined with gas or air tamponade with or without ILM peeling. Successful macular hole surgery is followed by sequential restoration of ELM and EZ. The ELM is defined as junctional complex between glial Muller cells and photoreceptor cells, which serves as a barrier against macromolecules. EZ clinically defines photoreceptor integrity and is rich in mitochondria. Visual outcome after macular hole closure is significantly better in eyes with restored EZ. The aim of the study was to develop a novel ELM and EZ restoration-based grading system for successful macular hole surgery and also to evaluate the EZ as a structural biomarker for final visual outcome. It was a tertiary care center-based retrospective study in which 34 consecutive cases of successful macular hole surgery were deployed. SD-OCT imaging analysis was performed on preoperative and postoperative data of week 1, 4, 12, and 24 respectively. Sequential measurements of macular hole size, ELM, and EZ were performed using the caliper function of OCT machine. Macular hole was graded as grade 0, in which there was persistence of ELM and EZ defect. The best corrected visual acuity in this case was 1.13 plus minus 0.19 standard deviation. Grade 1, in which there was partial or complete restoration of ELM with shortening of EZ defect. The best corrected visual acuity in this group was 0.59 plus minus 0.09 standard deviation. And grade 2, in which there was complete restoration of ELM and EZ. The best corrected visual acuity in this case was 0.26 plus minus 0.06 standard deviation. The results table here shows that as we go from grade 0 to 2, the residual EZ defect decreases and the visual acuity consequently increases. The post-op vision and residual EZ defect have a statistically linear relationship, and the ROC curve analysis shows that post-op EZ is an excellent structural biomarker for visual outcome. The graph here shows the changes in ELM and EZ defect over time. As we can see, the size of the ELM defect is less than that of the EZ, showing that the restoration of the ELM precedes that of the EZ. Discussion. Adult mammalian retina has potential for regeneration. Muller glial cells proliferate and produce new neurons. Lee et al. In 2021 highlighted that follow-up duration, minimum lineal diameter, inner retinal layer thickness were significantly associated with EZ recovery. Yang et al. In 2021 demonstrated that patients with smaller diameter of EZ disruption and higher EZ band reflectivity tend to have better best corrected visual acuity. Kitahata et al. In 2023 showed that patients in whom EZ was restored in the autologous retinal graft had greater improvement of the visual acuity. We thus concluded that the novel grading system is physician-friendly, incorporates pathoanatomical aspects, and correlates well with visual outcome. During recovery, ELM restoration precedes that of EZ, and the ROC area under curve analysis shows that the residual EZ defect is an excellent structural biomarker for the final best corrected visual acuity after macular hole surgery. Thank you.